programme that I'm talking about today is a Masters of Health Science in Cognitive Behavioural Psychotherapy. From a career point of view, there is currently a shortage of cognitive behavioural psychotherapists in practice. This course will prepare students to be eligible to apply for clinical nurse specialist post in this area. Participants need to be registered mental health nurses. They also need to have relevant experience of a minimum of 3 years. So the course then has been collaboratively developed with our practice partners and in conjunction with academic practice partners in ATU Castlebar and ATU Donegal. So anxiety and depression are the two main presenting psychological mental health issues in practice really. So there's a whole module dedicated to that. The student learns huge skills around assessment and developing care pathways for people in those situations. And then as the student progresses, we have another evidence-based theory and practice module on the whole areas of more complex conditions. And more complex conditions such as maybe OCD, eating disorders, psychosis or post-traumatic stress disorder. So they'll apply it here in the campus, but also there's a professional practice placement, a minimum of 500 hours in a professional practice placement where CBT is used as a treatment modality. And the student will do observation initially and then actual one-to-one client practice. So at the end of this programme, they will be competent practitioners in CBT. Close collaboration has went into the development of this programme with our mental health services, and that's Sligo Leitrim, West Cavan and South Donegal mental health services. So the course is being developed in 2 stages. So stage 1 is 1 calendar year, and at the end of that the student can choose to exit at that point with a postgraduate diploma in cognitive behavioural psychotherapy, or proceed directly to the master's year, which is an academic year leading to the master's. Very, very attractive course in my opinion, because there's many courses where students learn a lot of theory, but then maybe have difficulty applying it in practice. Whereas students on this programme will have evidence-based knowledge. Not only that, they'll also have facilitated skills practice by practitioners out there working in mental health settings as cognitive behavioural therapists.